Okay, so in this video I wanted to talk about some of the things you should be looking out for when you're trying to teach knee cars. And so a lot of the times that I've taught knee cars to people who have never done them before or have no idea how to rotate at the tibia, generally have a very difficult time feeling the stuff they should be feeling. So to them, if you tell them to do a knee car, they might just go through the motion and tell you, like, I don't feel much. And so in this video, I kind of wanted to talk about how you can communicate what they should be feeling throughout the knee car by regressing it a little bit, and then learning how to go back to the knee car so they're actually effectively utilizing tension and irradiation to get the most out of the joint mobilization. And so just to kind of review what a knee car is, right? So for a knee controlled articular rotation, you can go into tibial external rotation, go into knee extension, tibial internal rotation, and knee flexion, and then you can reverse it by just doing that, right? And so what you should be feeling. So specifically for tibial external rotation, when you're going to tibial external rotation, you want to look for tension and engagement in the lateral part of the hamstring, and generally that's where you'll feel a lot of the stuff help pull that tibia outward. So if you can see, I don't know if you can see this, but when I go into tibial external rotation, you can see my lateral hamstring engage, and that's what you should be looking for in regards to engagement. And some people are so stiff that they barely have this rotation, but as long as they feel that, they're doing it right. So if you're working with somebody who's very limited and you don't see much motion, but they communicate to you that they're able to feel that tension, that's a win. So that's them actually being able to do it right. And as long as they're able to guide the tension there, it's a good entry point for them to mobilize much better in the future, right? So as long as you follow that up with some Pales rails and open up that range, the tension is going to allow them to guide that effort much more effectively. So that's for tibial external rotation, trying to feel it on the outside of that hamstring. Now for tibial internal rotation, it's a little tougher, right? And so for tibial internal rotation, I like to do a variation of a Pales rails where you block off the tibia and you learn how to feel the deep tibial internal rotator. So if you wind your foot up in towards the midline and you basically wind up that tibia into full internal rotation and you try and abduct the knee, what you should feel is stuff inside the knee really contract and engage to be able to maintain that foot down. So what you would want to cue is a hard pronation of the foot as you go into more abduction, and you should feel some of the inside of that shin, maybe the inside or the back of that knee, and that's what you want to try and see if you can communicate to somebody as to what they should be feeling when they go into tibial internal rotation. Now that one's a little tougher. You may also even feel it on the medial part of the hamstring. So notice I'm not really talking about muscles too much. I like to communicate more so regions or locations of where they should be trying to look for tension. It's a lot easier when you're trying to communicate and teach somebody who's doing it for the first time or is having trouble gaining connection to that knee. And so once you're able to effectively teach where to feel tension in the tibial rotation, that's when you go back to axial rotations. And at that point, once tension is established, you should be able to isolate fairly effectively. And at that point, you can reintroduce hinges. So now I'm maintaining a particular rotation. So in this example, external tibial rotation. And then I'm hinging into extension and flexion. Once I got that down, I go into tibial internal rotation and I hinge back and forth. And then the final product would be putting it all together, winding into full external tibial rotation, extending the knee, winding into internal, and flexing the knee, and then reversing it. And so that's something that you can do to be able to communicate how to feel knee cars better. And it's a pretty easy progression to teach somebody who's having issues making that connection with that knee joint. So try that out, let me know what you think, and enjoy it.